I feel better that we have someone like you involved, like truly, because, you see biohackers who are weightlifters. It's like, that's not who I want to trust in this process.
I freaking had an airline stewardess try to sell me peptides.
Welcome in. You're listening to Medical Spa Insider, presented by the American Med Spa Association. We are happy to have you with us. This week, AmSpa founder Alex Tiersch is live from MSS with AmSpa friend and collaborator, Dr. K. Durairaj, to chat about longevity, innovation, and an exciting new technique she's sharing with her patients. And if you want to share something exciting with others, leave a rating or review on your platform of choice. It is always appreciated.
All right. Welcome back to, I was trying to think, how many times have we done this?
I think this is our fourth or fifth.
It's at least the fourth.
At least the fourth.
It might be
sure.
the fifth.
Yeah.
It might even be the fifth. The amazing, lovely, and talented Dr. K. Durairaj, who is, did I pronounce your last name right?
You said it so well. Yes.
I've been practicing. I have to admit, I've practiced. We are at Medical Spa Show. We are doing podcasts, obviously. We have this thing that has become a tradition now, where we do a podcast and a TikTok dance, which we just completed. So those of you who are listening, you can see that. I want to apologize in advance. I don't think I held up my end of the bargain. Madeline did a great job. You did an amazing job. I think I'm going to be replaying my
No, all of our
that.
TikToks are amazing.
I'm going to have to, I'm going to be practicing. We'll have to take two tomorrow. But welcome back. I appreciate everything. You've obviously helped us out so much with this event. You're doing a whole track on regenerative medicine, and you're doing a keynote address tomorrow in front of the whole conference. And not only that, you're still kicking ass and taking names in your practice. Welcome to the show again. How are you feeling?
Cheers. I'm doing good. I feel like it's such a fun meeting. I look forward to this meeting all year. I love the enthusiasm. I love the people. I'm really excited to bring biohacking beauty.
Biohacking beauty. That's
this concept that you and I just chatted about. I feel like we talked about it on a podcast and then we made it happen. Yeah, we did.
I think maybe like 2 years ago, because last year you started it.
Yes.
Right?
Yes. We had a really packed room, standing room only last year. And with this resurgence of interest in peptides and longevity and, exosomes, nanofat, there is so much biology of beauty to learn. Yeah. And the biohacking side of things, I don't want the biohackers coming into our space. We are the medical providers. We should be doing these things for our patients. No more gym bros, influencers, Instagrammers. I want it to come back to our aesthetic medical provider.
What is like you said, you used that biohacking. I know what it is because you see, on the internet, and you see these folks who are like, it's kind of an unregulated, just craziness out there. But at the same time, it's not necessarily unregulated. It's not enforced, kind of the same way that we were doing things, back in the day. But like, how did we get there? Like to where we are?
I think there's so much interest now in people wanting, it's not about looking young anymore. It's about wanting to feel so good inside and make that last. So it's performance that people look for, and they're not waiting to deteriorate. You go to your doctor, gives you your labs, and you're like, okay, you're not going to die this year. Well, that's not good enough for me. Look at what people are investing into their bodies these days, yoga and, performance strength training. And so I think we have this generation of patients and new age doctors who want to really push the envelope. Like, we don't need to wait for deterioration. Our cells have the power to heal, and we need to be able to turn on those factors. And in a lot of ways, it started with the supplement industry. And I think there are peptides that have been used in medicine for the last 50 years. Yeah. Insulin is a peptide. Growth hormone is a peptide. GLP-1s are peptide. They've been safely studied. So peptides are not a problem. Yeah. It's just this uncontrolled use and unregulated products that are formulated in an unsafe manner. And, you really need to have someone who knows what they're doing. And there's a scarcity of that in our industry.
It does seem like you mentioned supplements. It does seem like there's been this with peptides, especially. They almost like the supplement industry kind of took part of what was happening with medical, the longevity, the peptides, and they just kind of went with it, like consequences be damned, and started developing stuff, right?
Yeah.
And which was scary, but it also, I mean, do you think it had actually had any positive effect? Did it advance things at all, or is
I
it just,
do think so. I think the original biohackers were sort of the weightlifters and bodybuilders of the
Yeah.
world who are in the gyms
Like
and they're
doing
giving
steroids.
themselves
Yeah.
steroids and shots. And like some of them look really great. Some of them look abnormally bulky and hulky. But I mean, the fact that they started and gave like all of us a view into what it could look like if you could increase performance of your muscles and your strength and your bone density, like all these things, they're going to come to medicine. But if we wait for modern medicine to do the research and the FDA to approve any of these meds, it's such a slow process. You know, it's like a 20-year process to bring a drug to clinical trial stage 3. And I don't know that we're going to reach that stage. So it's nice now that we have, you know, RFK is great. It's great that he's bringing this conversation to the forefront because the FDA is too slow to approve things, I think. I think they're cutting edge drugs and treatments that maybe don't need 3 sets of clinical trials.
Yeah. That kind of is what we're dealing with right now, right? Is that you have these cutting edge treatments, and yet we're dealing with regulations and approval processes that are not designed to deal with cutting edge treatments in the way that we kind of want. But you know, there's a reason that those processes are in place, and there are plenty of folks who will argue, including many loud and vociferous voices right now, who will argue that you know, that's out there, and the reason it's there is for safety and patient safety, and we need to follow it. I mean, where do you fall on this? Because this is such a big issue right now with peptides and with PDGF, and it's kind of
a turning point in our industry and for medicine in general. Like we either need to innovate, but we need to catch up with standardization of innovation. I'm all about evidence-based medicine because like BPC 157, for example, very popular peptide. Everyone says it's great for bones and joints and pains and injury repair. But if you actually do a literature search, there are under 5 research published papers and they all have under 10 or 20 patients, and there's not a lot of knowledge, but there are hundreds of thousands of people using BPC 157 right now. And so we're all the test generation. So I think it's super important to rein that in and look at evidence-based treatments. And everyone needs to protect their license above and, you know, first and foremost, don't risk your license. There was a case of a provider in Utah that just went to jail for selling peptides that were formulated overseas as research peptides, and he white labeled them. And like this is happening everywhere right now.
I mean, so there is a process for that, and that is the FDA. Like the research process for that is in place.
And even if you just do a clinical trial, like in your own office, you can see 20 patients, track and measure and have landmarks for measurements, like have a dashboard for success. You can't just prescribe something and say, oh, it's working. You really have to have metrics. So we do biologic age testing, blood work, and there are ways to track these things, and people who are learning about peptides and doing it in their clinical practice, that's, you know, so interesting, and it should be published.
Yeah. I agree. So what is, like, what's truly the issue then? Because like what we've seen right now in aesthetics especially is we've kind of seen like a few of these groups kind of eating their own. Like it's become this thing, right? Where there's been battle lines drawn, and it's kind of become nasty. I don't like the fact that there's this infighting, because I think there's so many other things we can be battling about.
Yeah.
And I understand it to an extent, but like, and for those of you who don't understand what I'm talking about, like just if you go online and look at some of the PTGF comments, like it's been ruthless. Some of the things that people have been saying.
Has. It's turned into a discussion on Instagram and in social media, and it does not belong there. That discussion belongs in an auditorium, a lecture hall where data science and facts can be presented and also rebutted and also multiple opinions can coexist. You know, we don't have to attack each other personally.
Yeah.
So I do feel that the scientific knowledge about PDGF is super extensive. Like, you know, a lot of long-term use and FDA approvals have gone into the drug development. And sometimes that is a very natural extension to use that product at the next level. A provider can have the clinical judgment to use a product that is FDA approved for other off-label uses. That is just the fact.
It is. That's a little bit of it's a little bit of a gray area with PDGF based upon what it's FDA approved for.
Right. I think the biologics are their own category.
Right.
And I think we're just slow to catch up. Our industry has not evolved to the level of molecular biology and molecular science that we see, you know, at that high level. Like half the people in the audience don't understand the research, don't remember biology from 7th grade.
Yeah.
And that's not to be negative. I myself had to do a deep dive into learning, again, what's an exosome, what's a polynucleotide. And then as so much information gets thrown at us every year, it is a little bit overwhelming.
Yeah.
So I think first and foremost, back up and do some reading, white paper research, and reestablish what you know, and then ask all the right questions.
Yeah. And I guess one of the things that, and this will lead into, because I want to get into what your biohacking session's about and what you're going to be talking about also with your new treatment that you've figured out with
my mid-face miracle lift.
which is really cool. Where I've always been coming with the not only the PDGF, but also just all of the exosomes and the peptides and all that stuff is our industry is so misunderstood by a lot of the regulators and is not necessarily viewed in the most positive light. And so I totally agree with what you're saying. I think we need to be more science-based, all those things. And I agree with a lot of what the folks who are supportive of PDGF and all, like I'm on board with them. My whole thing is that I get it, but if you break the rules, even on something like this, where we have a really good, like there's good scientific basis. There's been a lot of studies on this, but the fact of the matter is, if there's a bright line rule or even not a bright line rule, and we get kind of dinged for it, the consequences on our industry, I think, are a lot graver than they might be in others, just because we're already viewed, and this is more towards med spas than it is plastic surgery. I mean, you're in a different spot, but like some of the folks that are out there doing stuff that are NPs that own their own med spas, like we can't afford to have negative marks against the medical spa industry. And I don't care where it comes from, because we're already fighting an uphill battle. And that's kind of a nuanced argument to make. And people don't buy it when I say that, because they just want to do these treatments because they're effective and people love them and they see such great results. And I'm like, I get it, but we got to do it the right way. Otherwise we risk setting ourselves back. Does that make sense?
It's taken 20 years for us to build a reputation as being aesthetic medical providers. And like, this is a real class of a specialty of what we do in medicine.
Yeah.
And you could destroy that in literally 1 year. Yes. Like it's just a few negative comments, reviews, arrests, these are serious things that people are risking their medical licenses for. And you have to take a step back and decide, is it worth it to you?
Yeah.
Like,
and what's the impact on the overall industry and space?
Exactly. It's going to cause us, I think, to get tightly regulated. As soon as there's 1 or 2 incidents, the regulations will come down, and the lawmakers don't understand the biology, and they don't understand the nuances of like what is and isn't, outside of FDA approved use. And I don't want to tie our hands. I want physicians and providers to always have the ability to take an FDA approved product and use it as their judgment sees fit. Yeah. Like so many drugs, we do that with so many drugs, and the biologics maybe have to advance to that level. But I also want providers to back up and stop making yourself the test generation. Like I study a lot about rapamycin. You've heard of rapamycin, this anti-aging drug that people take. It prolongs lifespan by up to 20-30% in animals. Yeah. And the woman who's done all the research on rapamycin, the clinical trials and extensive studies, Joan Manick, she was asked, does she take rapamycin? You must, because you've seen all such great benefits. And she's like, no, I'm not ready to, because we don't know the correct dosage, the duration, side effect profile in full.
Yeah.
And like,
only
she's
been
the
used on
chief scientist
mice.
who knows more than anyone in the world on rapamycin. So for me, that was very much like an aha moment. You need to be very evidence-based.
Yeah, I think that's the answer that we
I
have to
also
get
had a
across.
moment like that myself. I took BPC 157 for a year. I vetted the pharmacy. It was good. Everything seemed up to date with their certifications, et cetera. So I took it. Then I felt like, is this placebo effect? Do I really feel it? I think I feel it. Yeah, how do you know? You're an N of 1. And then I gave some to my mother-in-law because, maybe I thought her back and her aching and her Parkinson's. And then she felt funny. And then I was like, oh my God, what have I done? I don't even really know what's in this bottle. I was like, what the hell am I thinking?
Goodness.
I don't actually know. It's not like they've developed an FDA approved drug, right? The recipe changes pharmacy to pharmacy, the
Right.
duration, the stability, everything, the slight flavor differences are different according to each manufacturer.
Yeah.
And that could be enough to push a person on the edge over the edge. So
Yeah.
it was a real wake up moment. I was like, I don't know if I'm ready to give this to patients.
Yeah. I think that's,
And I'm a peptide advocate.
yeah.
And I will continue to try peptides on myself. I'm trying one at a time, seeing kind of how I like the feel of it. Do I notice a difference? And then I'm working with doctors, colleagues and friends in a longevity doctor group chat where we have collectively 25 years of experience. So we can, that is what people really need to do. And then you can hear from someone who's prescribed this product already for 25 years what their experience is. And then you feel a little bit more comfortable. So I'm learning that way.
I feel better that we have someone like you involved, truly, because, you see biohackers who are weightlifters. It's like, that's
Yeah.
not who I want to trust in this process.
I freaking had an airline stewardess try to sell me peptides.
God.
Yeah, she's really cute and peppy. She's like, are you taking peptides? Because I have some and I think you'd be really good for them. And I was like, have you attended this, or this conference for
She's
longevity?
like, I have some in my pocket.
I'm like, where'd you get them? Oh, there's some guys at my gym that get them and sell them,
God.
and I'll put you on just the right, cocktail, and your stack will be amazing.
Your stack?
Yeah, your peptide stack.
Oh, God.
And then putting them in combination therapy too, when they shoot them all up in a bottle and give you the glow complex, that is also not recommended because the peptides have interactions amongst themselves. They denature, they affect
Now,
each other.
what did you say to her?
I gave her the names of 4 different conferences she should attend, which was the A4M, and then a couple longevity courses that she could take. And then, there's ways to learn this stuff. And it's through people who've been doing it way longer than you. It's not through the gym bro and the airline stewardess. And frankly, it's not really, I don't know that the med spa industry is ready for all of this. We're bringing it, and we're teaching with high-class experts at Biohacking Beauty.
Yeah.
So for those of us that are excited and want to push the envelope like I do, I feel the aging process hitting, and I want to slow it down, and I want to optimize my health. So I'm ready to take those next steps. So for people who want to learn, you need to come to a meeting like AmSpa and attend Biohacking Beauty, and don't go to fringe meetings, where it's a little bit crazy and there's too many hackers around. We want science in our meetings.
Yes. That is kind of a terrifying story.
Right?
I'll take peanuts, a Jack and Coke, and a peptide stack on my flight, please.
It's actually not a bad marketing strategy. She cherry picks who looks like they're in good health, who dresses cute, who has got a little revenue, or got a good purse. Okay, I'm going to talk to that chick. Look, so funny.
Yeah, we'll tell the FDA guys that are here about that, and they can
So
start.
there are FDA guys at the meeting. Yes, I heard that.
We've been in. I was in touch with the. I'm actually kind of excited about it. These are 2 senior regulatory attorneys with the FDA, and they both with the kind of compounding pharmacy side, and then also with just the investigation side, and they're very interested in med spas, and they want to do outreach, and they want to develop a relationship. They've got interest in peptides. Of course, I started talking to them about a bunch of this stuff, and they had no idea what I was talking about. But to their credit, they went back and started learning. So I'm a little nervous because the last thing I want is for them to come here and be like, start,
You brought the government to our meeting.
But I mean, at the same time, like we need to have that dialogue.
Yeah.
They need to learn about what we're doing. They need to, the
I
biggest thing.
would love it if we give them guidance on
Yes.
how they should regulate this.
Well, and that's the main thing is they need to know how our business works. They need to, and that's the main thing that I told them. Like I said, you're not going to find, what you probably think med spas and how we operate is not what you're going to find at this meeting. You're going to find a lot of people who are very dedicated to patient care, who want to do things the right way. They want to know where the lines are drawn so they can go inside the lines. You're not going to find a lot of biohackers, which is exactly what he thinks med spas were, counterfeit Botox, biohackers, stewards is selling peptides. That's the perception.
Right.
That's when I say we're already behind. Like if that's the perception, we have to correct that perception.
Yeah.
And so that's the first thing that I think now is just to get them exposed to the fact that there's someone like you, and then all of the med spa owners who are really dedicated to doing it right, even on stuff like peptides but they want to make sure it's done clinically and safely and all the research.
Yeah.
They've
I want
gotta
to
see
bring that whole sector of learning to AmSpa because this is not going away. Peptides are incredibly powerful molecules, and they do have the ability to reverse some of the aging changes that we feel. Yeah. Your body's at its peak at age 20, and then every 10 years, like decline happens because the cells are just not getting the same level of nutrients and support. So if peptides can do that, why would we not do that? Why would we not give ourselves? NAD levels are dropping. The cells can't repair. It's just, aging is a disease. And we have to start treating it like that. And we have to start preventing it from deteriorating. And so I think that we should teach this here and like formalize it. And, as much as we can, really bring standards of if you're bringing this into your practice, this is how you should do IV drips. This is how you should do NAD. This is how you should do peptides. And that's what we're talking about at Biohacking Beauty. Yeah. Along with like showing people the future, which is things like topical rapamycin, the rapalogs that we're going to use to reset cell aging. Literally, I can take a picture of a fibroblast that's 50 and it's fat, lazy, senescent, bloated, and then you use the rapalogs. The RLX-201 is one of the products that does that, and it changes that fibroblast to skinny, spindle-shaped, like a 20-year-old fibroblast. So your soldiers that build your collagen are changing back into youthful state. They're ready to march again. So it's so cool.
And
that's from studies of cell cultures that show those cells can revert back to their youthful state. So we really have so many frontiers of biology where we have David Sinclair, who has now got the patent on reversing aging in cells and is using those things called Yamanaka factors to reset cells and reverse age change. The cells actually anti-age.
When are we going to get to that? When's that going to happen?
Well, he's doing clinical trials already.
Really?
Yeah.
On humans?
He did all the animal studies, and they're launching the first human clinical trials. They've done some in Japan already.
That's different from the erythromycin?
Different from rapamycin. Yeah, different from rapamycin. So he's using something called Yamanaka factors, which go into the cell and turn on some of the more youthful genes that were shut down.
Okay, and what's rapamycin then?
Rapamycin's a drug, so it's given to transplant patients, but they developed a unique use of it, which was at certain doses. Like usually people take like 6 milligrams every other week, and that is just a drug. It was found, it was developed as an antibiotic, antifungal, anti-transplant, and now that's become an anti-aging thing.
And that was the one where they gave to like dogs, I think. And
exactly. There's a rapamycin study going on with dogs right now that shows it's improved dog aging. Yeah. Since humans love their dogs, and some humans are on it. Lots of them, like Dave Asprey, and those the folks that are slightly more experimental.
So the human trial, though, and that actually causes the youthful cells to like activate, and
that's with the new company Rapalogics, and they have the product called ReQ, which is already available. It's a topical skin cream. And these studies are ongoing, and we're doing one in our office, and I'm very super excited about that.
I want to do it.
I'm going to get you some. I'm going to get you some. Next time I see you.
I still need,
you can be a newborn next time I see you.
Yes, that's what I'm talking about. So tell me though, because we're going to blow up against time. Tell me about your new procedure. What do you call it again?
I call it my mid-face miracle lift.
Miracle
And
lift.
this happened because I read a paper that showed this guy in Italy used some hyperdilute calcium hydroxyapatite, or I don't know if I can say brand names,
Obviously.
Radius. And then the wrinkles all were erased on these series of ladies' faces. And I was like, this is impossible. How could this happen? So I took it upon myself to try it in my practice. And he was using a dilution of, thinning out down this collagen stimulator. So it was improving the tissues. So I built this study in our office. We did 30 patients. We were just looking to reverse aging changes. And when we injected them, I developed a new way of injecting. So we've always just been injecting skin and dermis with all of our fillers, with all our biostimulators. This time around, I injected the fat pads of the face to give lift and support. So we studied 30 patients. We mapped and monitored their faces from beginning to end, 6 months. And everyone did great, 90% improvement in lift of their cheeks, tightening of their jawline, firm top, better skin. 4 patients did not improve. And we were like, what the hell? How did these people not get better? Why did everybody get better and these ladies had no improvement? When we went back and studied what was going on with those 4, they all secretly started taking GLP-1s during the study. So these 4 ladies lost anywhere from 20 to 47 pounds. And each of their face images stayed the same. They did not get Ozempic Face. So this was actually proof of concept that if we maintain and support this facial fat pads with the collagen stimulator, no Ozempic Face. So this has led to like a whole paradigm shift in how I'm treating patients' faces. I'm replenishing facial fat with these collagen stimulators. They bring in more blood flow. They bring in all the growth factors. They lift and support, and it maintains because collagen
and it prevents Ozempic Face.
Yeah.
So that's crazy.
And that's using hyperdilute Radius. And this study was also so inventive because it was 1 syringe to do the whole face and 2 visits. And that's all it took. Or imagine you lose 47 pounds and you don't get Ozempic Face. It's a beautiful thing.
No, it's amazing.
It's pretty darn awesome. It works for everything, for menopause face, for gravitational aging face. So the changes of aging and Ozempic Face are very similar. It's fat deflation, drooping, and descent.
It's weight loss and aging, right?
Yeah, and if you can replace that by building collagen, the new collagen molecule has a half-life of 10 years. And you're building long-term foundation, and you're not getting a filler face look. So it's really lovely to be able to bring this idea. Now I'm running a bigger clinical trial to go investigate this idea. If we treat Ozempic Face preventatively at the beginning of your GLP-1 journey, can we stop it and never get it? Which I think is true, but based on 4 patients, now we're going to expand to 48 patients. And then we have a second group in there that if we lose weight for 6 months and allow all that facial change and lipoatrophy to happen and then treat you, can we reverse Ozempic Face? And I think the answers are going to be amazing.
That is really cool.
Yeah.
That's really cool.
So this is a technique I'm going to teach at our conference
You're
and demo it
and
give people the tools to go back to their offices and very economically, 1 syringe, just to treat so many different things.
It's always, I feel like there's a lot of and I don't want to call it a mistake, but like an outcrop of something that you did.
Serendipity, right?
You didn't quite think this was going to happen, and here it is, and you're just like, oh my god, look at this! This is crazy. So you were trying to achieve one thing, and
2 papers out of that. One was proof of concept that you can prevent Ozempic Face, and the other was just it's a beautiful anti-aging technique.
You're just a certified badass.
Oh my gosh! Cheers to that.
I mean, congratulations on everything. That's very exciting. I mean, you're going to be like a world famous, you're going to get it patented. I guess, how could you? So, but there's got to be a way you could.
Right. My trade, I need to work on trademark. I'll have to talk to you later.
Yeah, we'll figure that out. I think for sure. That's awesome. That's really cool. Yeah. And you're presenting that also at the general session tomorrow. People are going to love that. Yeah.
The regenerative field is exploding. And I want to make sure people understand that this next phase of aesthetics is reversing senescence. Senescence is a process where the cell ages and deteriorates. And we have so many tools to change that, whether it's laser, collagen stimulator, these techniques like my mid-facelift, the peptides and supplements, like this is the real thing we need to do to change how we age, the trajectory of how we age.
Do you think, I mean, I'm 51, so in the next like 25 to 30 years, can we do it to a point where I'm going to...
That's a plan. We have to do it soon, right?
I don't have forever. I mean, Madeline's
I think
live
in the
forever,
next,
I'm
imagine
not sure about me.
the next 10 years, what the next 10 years will bring. This last 2 years, which is PDGF and exosomes and like so many incredible tools that we have now, this ReQ, the rapamycin product, we have a lot coming.
That's
and
true.
it's so important. That's why you and I talk and worry about like, how do we keep this industry tight and focused so we can bring all these tools and not get shut down by your FDA friends that are visiting.
Yeah. Maybe I should cut them off at the door. They're welcome. They're welcome. Well, thank you again. So we'll have to go back and count how many times we've done this, and we'll have to keep count.
For sure. It's always a pleasure.
This is so fun. And then make sure we get the TikTok right, because I think I might have ruined that one, but that's all right.
No, you did good.
But yeah, thanks again for coming. And then we'll have to see if we can expand the biohacking thing. I think you're right. There's so much there. And the only thing I worry about with our business in med spas is that you're right. They're going to take it and just kind of run with it. And it's like, I want them to be involved, but
I think if we give people the structure of come here to learn this, everyone wants to learn, and they're just getting tidbits off of social media. And a friend said this, and a person said that, and there's no good science out there. So we can bring it together in a really great way.
All right.
Excited to help you with that.
Thank you very much. I appreciate it. So great.
Well, thanks for having me. It's always a pleasure. You bring together a great group of people. I just want to tell you that, because I go to a lot of meetings, and all over the world too. And honestly, this is one of the most fun. And the reason is...
It's not the most.
Okay, it's the most. I have to say, I think it is the most fun, actually. But
it's all right. I get it.
You need that. We have the enthusiasm. We have people that are humble and knowledgeable. And when you bring those three things together, everyone feels welcome. And that's what it is. It's like open arms, come and learn, and you're going to leave here having a great time. You know what? You're right. I just was talking to a physician at the boot camp we're doing, and she said, I've been to so many conferences. It's the first time I've been here. And she's like, I feel like I've found my people. Yeah. And I was like, that's awesome. And it's because everyone comes here, and it's like, you don't know until you're here. Yeah. So I appreciate you saying that. It's cool. So it's a great tribe. So congrats. Thank you. And thanks for coming again. And I look forward to seeing your talk tomorrow, and for, future Nobel Peace Prizes that I'm sure you'll win in the future. Oh my gosh, if only. I'm working on hair. That's my next big project. So I'll update you soon. But if anyone wants to reach out or ask me questions, find me at Beauty by Dr. K, DrKay. That's our Instagram, and all my handles, Beauty by Dr. K. Yes, thank you for mentioning that. Awesome. Yeah. All right, cool. Thank you so much. Love you. Stay beautiful. Yes. Stay young. Thank you to our producer, Madeline Moeller, marketing content coordinator, who organizes the podcast schedule and guests and provides topics and talking points. Audio and video editing, voiceover, graphics, and platform management is provided by myself, Derek Hawk, digital marketing supervisor. Our themes are provided by Maka Music. Thank you for watching or listening to the Medical Spa Insider podcast. Please follow or subscribe wherever you listen to your podcast, and subscribe to our YouTube channel for future episodes. Ratings and reviews are greatly appreciated. For more information about the American Med Spa Association, visit americanmedspa.org. Reference to any specific product or entity does not constitute an endorsement or recommendation by AmSpa. Views expressed by guests are their own, and their appearance in the program does not imply an endorsement of them or any entity that they represent. AmSpa provides this podcast as a local service for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Please consult with an attorney on your legal issues. And as always, thank you for listening to the Medical Spa Insider. Remember, compliance is cool.